Hello and welcome to Eye Insider Ophthalmology Simplified. Here we simplify topics related to eye and ocular diseases. So if you're new to this channel, please subscribe and hit the bell icon so that you don't miss any updates. So today we are going to discuss about various cover tests. So we have cover uncover test. In the cover component, it describes the tropias. So we cover the straight eye and then look at the other eye. The movement in the other eye indicates tropia. So we are covering the straight looking eye, and the other eye, which has squint, moves to take the fixation. If it moves in, it has exotropia, and if the eye moves out, it means it has esotropia. So the eyes moves to take up fixation, and the uncover component reveals if the eye has any phoria. So in this, we remove the cover and then look the eye behind the cover. Okay, so if the eye behind the cover moves in or moves out, that means it has exophoria, that is latent squint. So in this way, cover uncover test is useful in case of manifest squint to know what is the tropia or phoria. So this is in case of the patient with manifest squint. So in the case with manifest squint, when we do this cover and uncover test, it can reveal the fixation and dominance. So eye with squint will take up fixation if the vision is good. And how to know the dominance? If the eye returns to squinting position when we remove the cover, that is the binocular single vision is established, it means it has less dominance. If it continues to maintain fixation, that means it has equal dominance. So in this way, in a patient with manifest squint, it can reveal the type of fixation and dominance. When we are doing this in a normal patient who has no manifest squint, so it will reveal if the patient is having latent deviation, that is phoria, and the speed of recovery of the phoria. So what we'll do, we will cover either of the eye, and if that eye is having any kind of phoria behind the cover, it will go into that position of whatever phoria it is having. And when we are removing this cover, it will go back to its position, normal position. So that is known as recovery movement, and the speed with it comes back to its normal position, reveals the speed of recovery of that eye. So in this way, we have to perform it in both the eyes, and also at the near fixation, we have to ask the patient to fixate at a near point and also fixate at a distant point. So we have to perform for both the eyes, for both near and vision, to know what type of squint they are having. Next, coming to alternate cover test. So in this test, we are abolishing binocular single vision to take place. So it will reveal the heterophoria, that is latent squint, and intermittent heterotropia. So it will either increase or it can become manifest when we do this alternate cover test. So how do we do this test? We quickly cover the eye one after the other so that there is no binocularity being established, and at the end we remove the cover so that there is binocularity occurring. So in this way, when we remove the cover at the end to establish the binocular single vision, what will happen? Either the eye which is having a phoria or tropia, whatever, if it recovers immediately, that means it is having a heterophoria, that is latent squint. Or if it stays manifest, that is the squint is appearing now, it means the patient is having intermittent heterotropia, right? So this is very important. Now coming to simultaneous prism cover test. So in this we place this is performed after the cover uncover test. So here we will measure the amount of tropia the patient is having. So we already know the patient is having tropia. Now what we'll do, we'll cover the normal appearing eye and then perform the place prism in front of the deviating eye. So the prism, as we know, the apex towards deviation. So here we are using a base in prism for a exotropia. So slowly we will increase the strength of the prism till there is no movement. So in that way the strength of the prism reveals the amount of tropia it is having. So to know what is the degree of squint with relation to prism diopters, you can watch the video in the information bar. Then we also have this alternate prism cover test. So in this test we will measure the total deviation, that is tropia as well as fovea. So in this we use a prism and do the alternate cover test. So here we are using a prism in front of the one eye and then we are doing this alternate cover test, keeping the prism over that eye. So the amount of deviation, that is till the patient has normal, it will increase the power of the prism. So it will reveal the amount of deviation which is present in the eye. So this was regarding the various types of covers test. So I hope you like this video, and if you like the content which I am being posting, so please like, share and subscribe this video. It takes a lot of effort to get good content for you to present in this form. So please do subscribe to the video. So just to summarize, the cover uncover test reveals the tropias in case of manifest squint, the fixation and dominance. If the patient does not have manifest squint, it will reveal the phoria and the speed of recovery. So thanks for watching. Bye bye.